You have to start now, Angela.
Oh, hi, good afternoon. Hi, everyone. Thank you for joining. This is a pleasure to have the first Young Neurosurgeons Network webinar organized by us, and it's something that we have been building up to. We try to do this meeting as this first webinar as a continuation of our recent webinar where we discussed about how to plan our career in general. And since everyone around us is practically, we're more or less at the same level from the very early stages of our training till our training a little bit after the end of our training. Our basic training, at least. So we wanted to do this as some of the advice that you can have for every stage. So that's why we titled "How to Plan Your Neurosurgical Training." So my co-host Marisa is here with me today. Who's the chair of our committee and has been the mastermind behind most of the activities that we are doing at the moment. And we really hope that you'll enjoy that. We'll start with Christina Aldea, who's a neurosurgeon from Bucharest, who's one of the members that is mostly involved from all of us with the medical students. She's been a member of a student group since her medical years, and that's how she showed her interest in neurosurgery and how she built up to her training. And she organized she had the idea and organized the first European student meeting in our EANS conference in Belgrade in 2022. So we'll start with her, and Christina, the floor is yours.
Okay, thank you, Evangelos, for the introduction. I will share my screen, and I just want to say that I know it's a little bit confusing because we tend to mix it up, but actually I'm in Budapest now doing a fellowship on endovascular neurosurgery, and I am from Cluj-Napoca, which is in Transylvania. It's pretty easy to associate, with the vampire culture and all. And I also worked in Bucharest. So I'm a board certified neurosurgeon from 2021. Okay, and I am now actually training to become a hybrid one. What I wanted to accentuate at the beginning is that I'm only going to share a few of my thoughts. It's a very subjective presentation, so please feel free to share your input afterwards, because I think a free discussion will be more interesting for anyone. So I have been fortunate enough to finish medical school in Cluj-Napoca, where there was already a student club and student interest group established for neurosurgery. And one of the first questions, because it's a very controversial topic, when to start neurosurgery, because there are two schools of thought. Some say that it is too early for medical students to get involved in neurosurgery because it's an over specialization, and they should be they should go into medical school with a broad interest and see all the specialties. Others say that if you're interested in neurosurgery from your early years, it is good to participate in events relating to it. From my experience, I can say that if you feel an attraction towards this specialty, it's definitely an advantage to join such an organization, because you don't have the experience of a resident, of course, but you can see what the specialty is about. In many countries, the admission into residency is interview-based. So if you have activities from your medical school and research, or maybe presentations at conferences, which these clubs give you access to, it can definitely be an advantage. And I want to emphasize also that when speaking about clubs, I'm also talking about our network, because it's also a European-wide um, club that is also destined for students. So it is the same thing which I'm talking about. So definitely my idea is that if you feel an interest towards this specialty, you should join um, these relevant organizations. And there are such organizations in, I think, every major city right now in Europe and in America as well, because they are joining into this trend. So um, of course, if you're interested in neurosurgery and want to start with an advantage in your residency, you can do it by yourself. And the main things that you're going to do is, I don't know, lab work, maybe in a microsurgical laboratory. You have to study anatomy. You have to go to your, as Christina also always says, that if you're interested in neurosurgery, you should go into your local neurosurgical department and volunteer there. But the the thing that your local department doesn't give you and the club does is the sense of community connections, because it's pretty broad to say it like this, but when you will be looking for a job as a resident, or maybe you want to go to a fellowship, or I don't know, training abroad, connections do matter. And you see, even here in our community, the Young Surgeons Committee, we know each other and we can, visit each other, share ideas. So I think the sense of community is very important in these clubs. Also, I think it gives you motivation. For me, especially in my late medical years, um, it always motivated me when I was demotivated in medical school. I always found motivation in our student group activities, and it kept me focused on the goal that I want to be a neurosurgeon. I already said about the opportunities for research, and of course, it's also an environment where you can find role models for yourself, either through the club's activities or by maybe facilitating going to other meetings as well. Uh, because it's there are many student clubs. I think you should be wary of red flags, because I didn't name any of them, of course, but there are some that have toxic environments, and the students, they don't have really good role models. You should look out for these. So you have to discern for yourself if they mythicize the specialty, if they have low quality presentations or research, if they focus too much on the importance of status. For example, I've heard of a club, I'm not going to name it, where the students' main focus was who is going to be the coordinator and so on. I think those are not worth it. So if you come across such an environment, such a group, I think you should not join it. So you have to select these. These are just some pictures from some of our activities in Cluj. Here, there is the last masterclass. So basically organize the course for students, which we are replicating inside the ENS. It's basically a theoretical course about different topics. This year it was from neuro-oncology. And you see that there are faculties from the ENS, basically, as Marisa, Andreas Demetriades, and so on. And students have the opportunity to interact with them. Now, of course, we don't have raw data on how many students who start their interest and research in neurosurgery during medical school go on to become successful neurosurgeons. But as a local, maybe prototype result, there's a photo of a few residents from my hometown, me included, who were in this club and are now neurosurgeons. I think it's relevant. It's pretty logic. I don't think we need a study for this. These are pictures from the ENS Primitive Course for students. I think it was really a great opportunity for everyone to get a feeling about neurosurgery, what it means, to see that everyone can become a neurosurgeon if they wish so. And of course, you should join us in Madrid because it's going to be the next edition. And through this, I also want to thank especially Marisa and Evangelos and Diogo and the whole committee for helping us organize this event, and of course the ENS. Of course, as I stressed in the beginning, ultimately the most important for you as a medical student, besides joining these clubs, is going to your local department, working on the field, testing your passion, testing your limits, and see what are you willing to sacrifice, because basically that's going to be your work. The clubs are only facilitating your entry into this field. I had to put this quote on because it's one of my favorite things to read, especially when I'm down. Yashar's paper, a legacy of microsurgery, and there he also says that during medical school he describes basically his whole life, and it contains valuable lessons. And I just wanted to emphasize this, that he enjoyed the learning process immensely, and I think you should also focus on that, to enjoy it. And I think joining these neurosurgical clubs help you. This should be the goal, to enjoy the process. Also, it's not a thing without which you can't build a successful career. I think if you bloom and discover your passion during medical school, it's fine. If you don't, it's also fine. So don't feel discouraged if you're not decided yet, but you can still, I think it's still a good idea to explore these organizations. I think the most important is that each of us has his or her own path. I mean, if you, when you decide, how you decide to do it, it's okay either way. And joining the students' organization definitely has its advantages. And if you can't find one, you can establish your own, of course. So you can do it. It's like a motivation. And of course, join us in Madrid, where you can see these things unfolding live. Okay, so thank you. And please, Marisa, Evangelos, Milan, if you have any thoughts about this, please share them. And thanks for the opportunity of speaking.
Thank you, Christina, for your presentation. I think looking at these peaks, I think this is the first contact I had really with a big club of students in Cluj-Napoca. And to be honest, I went home quite shocked about how helpful this kind of club is for them, that you don't expect before. And what I learned from them, from Vlad, from Dragos, and from all the other people we met there, is that it was important for many things. The first thing is motivation, because they really find the motivation in what as you say, in the group. And also some of them are like looking for some role models to follow, because not all people know what they want to do or how they want to do when they are young. And the other thing I was reflecting about this course, that should firstly reduce the rate of dropout, because these guys who are going to these lessons and that now they are coming to Madrid and they came to Belgrade for the Primitive Course, when they will enter in the residency, if they decide to be neurosurgeons, they will be completely aware about what they can expect from. There is no doubt, and that's why one of the reasons why after that I decided to start with the skilled pre-meeting courses in Madrid. Now in the meeting, because I realized some of them were demanding some practical to figure out how it should be. And I think it's very important. To be honest, I didn't realize before. When I started with the network, was more thinking about the young neurosurgeons in terms of people who have finished residency program. They are board certified, but they are still not senior, and they don't have room or space in the big talks or in the EANS main places, but they are still active and they want to do things and they want to be part of. And that's why I started with the network with Evangelos. And slowly we realized that there was some demand also from students. And after Cluj, I'm completely not only aware that it's a good job and it's a good work to collaborate with them. I think it's also our responsibility as a society, and especially us as a young neurosurgeons committee and network, is our responsibility to lead them a little bit if they are demanding that. And some people did it with us. If not, it would have been great to have a young neurosurgeon as a reference. So I think we can provide that to them. And a club is necessary to be informed about what is happening, to, as you say, to know where you can go for observership, maybe 1 week, 2 weeks, only 3 days, and to move around. I think it's necessary. That's my reflection. I was very, very happy after Cluj about our contribution there. And that's why I will go next year again. I'm much more encouraged with the students and with young now than I was before.
I think you made a very, very important point, especially with that. It's helping reduce the rate of dropouts from residency. I think it's really, really important. And also, it's basically a selection. You're pre-selecting basically people. I think it's a very good idea to focus on this. As you said, it's also a responsibility of such a high society as ours.
And additionally, they can also know where do you want to go, because I remember when I choose neurosurgery, I was department. I went department to department asking how was the specialty there, and at the end I decided based on a table. I did, but I didn't know what I was going to, what I could find. So now they can be more informed because they have the tools to do it. They have us. Yes. But what do you think, Evangelos or Jose Luis, Milan? Yeah. You are very quiet.
It's exactly like that. It's very useful, and coming from a place where there wasn't something like that. When I saw what the discussions and what is being done in similar groups in other places, I was really impressed and a bit jealous, I should say, because as you said, of course, what Christina said, that everyone has their own path, and if you're interested or if you're not interested, you will find your way through things. But seeing what a group like that and what efforts like that, like the network and everything, can provide for people that are interested, and how early on someone can get involved and learn about the daily life, learn what the life means, learn what they need to do to become better, if it fits them or not, if it suits them or not. That's a very, very good first taste of what the life of a neurosurgeon can mean.
So let's move on to the.
I got pulled into neurosurgery immediately after I finished my medical school, but it was not my intention during my medical school at all. So I was quite amazed with what was there to see and to learn and to do, because when I came to the department where I am now working as neurosurgeon, and where I did my residency and where I volunteered during the residency prohibition in my country, I spent maybe 10 years before completing residency. So I never had any impression of neurosurgery from medical school, because in medical school it was like quite light version of neurosurgery. It was mostly like going around the wards, and the only thing I remember was that we had to do an examination for the comatose patients. So I believe this Young Neurosurgeon Network and the clubs that are for neurosurgery are very good way for someone to get into it, as Angelo said, and probably to select those who are interested in neurosurgery, definitely, and to provide them with the initial.
You can also build even task forces as we are doing, and you can pre-select people from the network and from the students who are interested to research or are interested to education or any other field? Or what do you think, Jose Luis? You wanted to talk before?
Yeah, I totally agree. I think some med students has a small motivation, but they almost don't know what to search or what to look for, and sometimes they need to find a model and follow him in order to increase that motivation or to build a stronger motivation.
Exactly.
Does anyone have idea of other specialties except neurosurgeries about these clubs and their networks and their programs for students? I'm not aware of this.
I imagine there would be. I don't know of anything very specific, but I imagine that there must be in other specialties groups as well.
I know for sure of general neurosurgery, the European Association, and the urology, also the European Association. They have similar programs.
At this point, I should say that there's a Q&A section in the chat. So for the attendees, if anyone wants to ask a question while we're talking, or post their question there, and we'll make sure to answer them either in the discussion at the end or while we're speaking after every talk.
Okay, if you want, I can introduce the next speaker.
Yep.
We can move on. I'm glad that this time we have two Spanish in the panel, and happy about Jose Luis wanna join us. So the next speaker is Jose Luis San Millán. He's from Barcelona, from Bellvitge, I think.
Yeah.
This is the other place I wanted to go. I had to choose between Bellvitge and La Paz, so it's a good place. And I have a lot of friends there. It's a very good place to train. I recommend you to visit there, Jose Luis, and he's going to talk about how to plan your basic neurosurgical training.
So thank you, Marisa, and thank you also, Evangelos, to invite me in this fantastic webinar. Let me share my screen if I'm able to. Sorry. Can you see my screen now?
Yes.
Can
Yes.
you see? Yeah,
Yes,
yeah, perfect.
Yeah.
So,
Yeah.
So thank you very much. I think this topic is very, very interesting. And I'm prepared a talk to dig a little bit in how to find what I call your neurosurgical home. I must say that I'm kind of biased in this topic because I'm the neurosurgical training program coordinator at my department. So I'm a bit biased, but I'll try to be as neutral as possible. And the focus of this lecture is about basic neurosurgical training. So basically, this talk is for med students. So if you are a medical student and you are listening to this, I assume that you have answered these two very important questions that are, do you want to become a neurosurgeon and why? And if you have done this previous work and you feel that you are a neurosurgeon, like this guy, and jump inside neurosurgery, your next thought, I'm sure, that would be, I want to become the best neurosurgeon. So which hospital is the best for do my training? So I'm very sorry, the perfect department doesn't exist. So it's more accurate to think in choosing the right hospital for you to do your training. During this talk, I'm gonna give you some advices, some ideas, some thoughts in order to help you in deciding. I won't cover some topics that maybe for you are important, like city, family, friends, boyfriend, girlfriend, and so on. And I'm only talking about from a neurosurgical educational perspective. So if you want to become a neurosurgeon, if you want to train in neurosurgery, you don't have time enough to visit all the departments in your country or your area, and you have to do some previous research. And we are very lucky now because we have internet and there's a lot of information there, but you need to know where to start. And a good starting point is for looking at the training curriculums of the departments. Almost every high-level neurosurgical training department has published the training curriculum. And the training curriculum is a document where we state which are the objectives for the residency in each year for the training, which is the supervision protocol of each department, and also the description of skills and competencies competencies the trainees has to complete. So truly, that is a guideline for the training. So how is the training really works? So at the beginning, you start your neurosurgical training without knowing anything, or even without knowing what you need to know. So what we do is take you from scratch and make you to become a competent neurosurgeon by giving you tools that make you develop some skills that at the same time those skills make you competent in some areas of the neurosurgery. And at the same time, we, at the beginning, supervise everything you do. And as you are getting more and more competent in more and more areas, we lower that supervision. That is the basis underlying every neurosurgical training. But you must answer now, you may answer now, which skills and which competence do I have to develop? For that, we have to ask ourselves, what does a competent neurosurgeon mean? To be a competent neurosurgeon means to be a good clinician. So you will need clinical and theoretical knowledge. You need to be a good surgeon. So you will need surgical skills. You need to be a good scientist. So you will need research skills. You need to be a good communicator. So you need communication skills. But that's not enough. You have to develop empathy, leadership skills, conflict resolution management, time management. You need to learn how to teach. You need a lot of skills, more than you think. And this is just an example of which skills you have to find inside those well-balanced and well-designed training curriculums. Beside the training curriculum in internet, you can also check what is the range of neurosurgical pathology the departments treat, because, for example, there's a specific area of neurosurgery that the department doesn't cover. You will have to travel to another department at some point of the residency to be exposed to that specific area. And for sure, you can also check the faculty expertise and the reputation of the department. I recommend you that you have to do it by looking for publications, scientific publication, or meetings organization, because you have to be very careful with mass media. Not every news that you are going to see in the newspapers or in the television are accurate. Ideally, the national committees checks for the level, standard level of education, of neurosurgical education, the departments of each state, but the ENS has gone a step forward, and thus exists this joint commission between the European Union and the UNS that audits the neurosurgical departments that they asked for, and award the high-level departments with this accreditation of Center of Excellence in Neurosurgical Training. So you can go there in the ENS website and check for the department that has this accreditation, because this is really a tough accreditation and those are high-level departments. So once you have selected your top sites, then it starts the next part that I think that is the most important, and is the part that also Christina has told you, that is building your network. At the beginning, nowadays you can use social media, or you can approach people by social media. Is very easy, very fast, and very convenient. But I recommend you that you have to visit the department. You have to go there and see how they work, how they live, and even if it's better if you are able to apply for an internship there. You have to speak with them. You have to speak with the residents, with former residents, with faculty, even with the chair of the chairman. We are busy guys, but usually we are kind people. And once you are there, what do you have to look for, or what do you have to ask? Well, what you have to do is just see how they work, what the resident does, and how is the training of the resident. If you want some examples, for example, I would ask, how the day looks like for a resident? Is the training curriculum realistic? What are the residents allowed to do in the OR in the different years? Do you have research opportunity? Does the chief resident do management tasks? And do the faculty members support you? And sometimes go to the department and speak with the resident, you are very shocked or very surprised, because you can find two different residents in the same department with two different moods. One can be angry and the other can be happy. Or even you can find the same resident in two different time periods with very different moods. That's totally normal, that's usual, they are not bipolar. Usually when you go through your training period, you will pass for sure for several emotional states. And basically those are related, or mostly related by the amount of work you have in that moment, and also the reward you get from that work. And speaking about workload, I would recommend that you have to choose a neurosurgical department with a heavy workload. And why is that? Because neurosurgical itself, we are very busy. We have a lot of work, but also we have frequent emergency, fast and difficult decision making. We have to keep our refined surgical skills, and we do complex and long cases. So usually it is surrounded by a stressful environment. So how do you train? How we make you to train in your skills and competencies, but also we train you how to manage this stressful environment. So the key of your neurosurgical training, the key of the success of this training is to push the trainee away from their comfort zone. So I will also ask if the faculty member challenge you. That's for me a very important question, because for me a mentor could be a friend, but most important has to be a model and has to be the person who challenges you. A few words about technology. Technology nowadays is essential, it's very important, but if you visit a site, don't be blinded by high technology. And to finish, just a word about simulation. In the next years, I'm sure that you're gonna hear a lot about the word simulation. Simulation is not only microstructuring or realistic model, it's also a powerful educational resource in which you can train you in surgical skills, but also in soft skills and complex situations. And remember that in your training, the most important part is you and your motivation. So don't ever forget, why do you want to become a neurosurgeon? And always be open-minded to be pushed away from your comfort zone. So thank you.
Thank you very much. Very, very interesting and well-structured talk, and how you should, what you should ask and what you should look for in the unit that you are applying or you're thinking about applying training. And I think that also applies for people that are already at some stage of their training, not even a very early one, and they're not very happy. They're thinking about changing. This happens to everyone, and this is not very infrequent to happen. So yeah, thank you very much. It's
thank you.
Good piece of advice. Perfect. Should we proceed with the next talk and maybe leave the rest for the discussion?
Please remind them they can chat in the questions and answers, because we are very, very lucky. Look at that, there are 70 participants. So that's amazing. But now they have to participate.
We already have some questions that many members of the network sent before we started. So unless they are answered, I will from the talks I will ask them at the end on their behalf. So it's a great pleasure to introduce the next speaker, Ms. Karabatsu, and to thank her that she found some time in her very busy schedule. I know we pulled her out of theater literally to give us this talk. She's a consultant neurosurgeon in the unit I'm working currently, and her main specialty is neuro-oncology, but she's been leading in multiple areas throughout her career: pituitary surgery, neurofibromatosis, training, teaching. She's a great mentor for many of the trainees in the unit, previous trainees and current trainees. And I would like to think of her as one of my mentors as well. She's also had her fellowship training in Canada, in Toronto Western, and she's trained in 2 different countries, in Greece and the UK. for the basic training. So I mean, this is the person to ask for, pursuing ways of enhancing your training and in the terms of fellowship training or even, training in general. So I'll leave the podium to you, Ms. Carabazzo.
Thank you, Evan, and thank you for the introduction. It's my pleasure to be here today. Probably I'm the oldest person out of all the participants, so I feel a little bit, but anyway, it's a pleasure to be here. As you said, I have worked in many countries, and it's quite topical talking about fellowships. It's very important for me to obviously train the fellows well, because I've left a very good fellow doing my operation and I'm here and I'm not too stressed. So I think my topic obviously was to talk about fellowship. I'll just share my screen and please tell me if I'm visible, if my screen is visible. Yeah, can you see my slides?
It is.
Yes, it is.
Yeah, it is.
Thank you. So as Evan said, I'm a neurosurgeon in Manchester and I'm the specialty lead for neurosurgery. And I have to say, this is a role I cherish the most out of all the roles I have taken so far. I had a lot of mentors over the years, but the person I feel most grateful to is Dr. Fred Gentili. Probably some of you who are a little bit older must have heard of Fred Gentili. He was an amazing, not only amazing neurosurgeon, but an amazing person, an amazing mentor. And having trained in Greece and then in UK, I got my fellowship FRCS in UK in 2005. I pursued a fellowship for actually a year and a half, almost 2 years in Toronto under Dr. Gentili in neuro-oncology and pituitary surgery. And I have to say that was a defining year for my career. Not only of learning how to acquire surgical skills, obviously that's very important, but also what it taught me is kindness, how to be passionate and dedicated about what you do and continue learning new things. At that time, Dr. Gentili, I think, was over 65, and there was a time where the endoscopic pituitary surgery came, and even then he took that on. So it's kind of very important. And I have to say, although I have quite a few publications, the publication that's been cited the most for me has been the one I wrote about the fellowships in Canada. So some of you today are already have taken a career in neurosurgery, some are still students, I guess, in the audience. And a lot of people ask, why you want to do neurosurgery? It's a topic I'm sure everybody will be asking you when you go to dinners. It's a quite a topic that always comes there, and all who have our own reasons to have done it. Maybe I think we find the anatomy and the approach is amazing. It's a personal gratification. It's something that the adrenaline runs high. You can do your research. People think you may be paid well. It's not the same in UK. You paid the same as a microbiologist, but a lot of other things that you have to think about: the long training, the burnout, the high stakes surgeries. And these are very important things to consider. Obviously, if I started again, I would do the same. And we all have, there's a lot of fascination in the media, so you know all that. So why would anyone who has pursued a career in neurosurgery, obviously you have almost finishing your training, you have decided that's the thing for you, and you come towards the end of your neurosurgical training, or you have already finished your training in your respective countries, why you want to undertake a fellowship. I think, as I said before, for myself, and I see for all the fellows who had over the years, it's the time to consolidate your experience. You may have done quite a bit during your training. I think it varies from department to department and from country to country. But when you get your fellowship, then you can just focus. You focus in your area of interest. People take you seriously that this is exactly what you want to do. And also you have the opportunity to get involved in research. It's not only you get a lot of confidence in personal gains and surgical competence, but actually from my experience and talking to the fellows, and I'm sure Evan will endorse that, your morale it's a big boosting experience to your morale. Also, we live in a very competitive environment. I don't know about obviously what's happening in the rest of Europe. I'm sure knowing the situation in UK and knowing the situation in Greece and other countries, it is a very competitive environment. So having done your fellowship obviously gives you a better chance of getting a good position afterwards. Again, the questions arise where to take the fellowship. Not only why, but where. So you can take your fellowship in your own country, or you can take your fellowship abroad. I think there are pros and cons, and I think to me, one has to balance obviously family, training needs. There are a lot of financial implications. There are language issues. Previously, for example, I'm just talking about the UK, pre-Brexit, it was kind of, I mean, still is not very difficult, but it was a little bit easier, for example, to come to UK. And if there are good fellowships in the place where you train, that's okay. But I think having the exposure to a different healthcare system broadens one's horizons, and I certainly felt that when I went to Canada, it was an opportunity to see how another healthcare system works, and take a lot of ideas and bring them back to your eventual place of work, and that's very important. As the previous speaker said, the most important thing for your fellowship is do your homework. Find a fellowship, first of all, that suits your future careers, and get in touch with the people early on. I remember I kept emailing Dr. Gentili like for 3-4 years in advance, like every 6 months sending an email. People do send a lot of emails now, but I must say the last few fellows we have appointed, they had pursued us very hard for years, and you can see a commitment, you can see their dedication, and also please get in touch. You may have to send a few emails. We are all very busy, it may take a long time to reply to the emails, but certainly the people who have a commitment to be supervisors for fellowships will eventually reply, and also get in touch with previous fellows, because they will be able to tell you their experience. Is this the right place for you? Do you get much out of it? And what certainly helps is visit the unit and express your interest in person. I went to Toronto before going for my interview a year and a half in advance. I just went across the pond, and I knew I had to compete with another, I think, 60 applicants. But the fact that I had been there, I think, gave me an edge to do that. And I think Evan had done the same before getting his fellowship. So I think that's kind of important. Obviously now we have that it's easier also with Zoom and Skype, etc. But I think nothing is like meeting the person face to face, if possible. And so I'll just talk a little bit about the UK fellowships. So there are 2 types of fellowships. There are the senior clinical fellowships and then academic research fellowships. The fellows will be expected to be part of the department and work along with the residents to different extents. So you will not only kind of focus on your area of on the skull base or the spine, etc. Obviously, you'd be expected to help. That's part of the teamwork, and also enhances the general skills. You don't lose your general skills as well, and work with the other staff, the other consultants. You would be expected to some extent be part of the on-call rota and the research opportunities, as well as involved in the general teaching. As I said before, things to consider certainly for UK is obviously now is visa immigration status, language fluency exam is expected, and it might be helpful that you do a shadowing period first, or when you start your fellowship, there might be a time of enhanced supervision. Going to a different system can be stressful. You don't know how the system works. You want to protect yourself. You want to obviously protect the patients and yourself from mishaps, so that there is an opportunity of how to always give a shadowing period depending on the experience of the fellow. And also one thing to consider is you go to a place where there is different cultural backgrounds. We all have come from different healthcare systems, and one has to take that into account. Obviously, there is the Caesar process, which I won't talk about now, but it's something that people who come from non-UK trainees can go through a Caesar process to get into consultant posts. So in UK, there are 2 types of fellowships. There are what they call kind of Royal College of Surgeons approved. They're supposed to be more structured and monitored with set curriculum and learning outcomes. That's not always the case. I have to say, excellent fellowships like the skull-based fellowship, for example, that Evan is doing, it may not necessarily be all of them Royal College approved, but actually they are very very good fellowships, internationally renowned. So all it means, you have to do the paperwork to get it approved by the Royal College. Sometimes that takes a bit of time. And there are other fellowships who call trust grade fellowships. They are approved by each individual trust. There is a bit more emphasis in service commitment, but there are plenty of opportunities to learn and get what you need out of these to go back to your respective country. So I'm kind of the head of the lead and clinical supervisor of the Manchester Neuro-Oncology Service, where we do 400 brain tumor cases a year. I think it's an amazing opportunity for any fellow to come and get as much experience out of it, and similarly, quite for other subspecialties. If you go to the Royal College of Surgeons website, these are kind of the Royal College Fellowship, the number of Royal College Fellowships approved, but there are quite a few other fellowships that you won't find in the Royal College of Surgeons website. You can always go to individual trusts website, and important information you can find in those. I don't know if everyone can send the slides later, but this is the SPNA, Society of British Neurosurgeons, Society of Spinal Surgeons. And if one wants to apply, then the way to apply is through NHS jobs. I'll just talk a little bit about North American fellowships, because I had that kind of dual experience as well. So predominantly for Canada, obviously you have ideally to have had, if you come from UK, the FRCS exam, or to have get your post-CCT training in any other European country. And I think it's desirable to have passed your ENS exam. If you go to US, then you have to have your USMLE exams, a little bit more competitive, I guess, and more demanding. And most of the fellowships, both Canada and US, are advertised in the ANS website. But again, you have to check individual institutions' websites. I'll tell one thing with my experience coming from Europe, European working hour directives do not apply in North America. I remember when I went there, the residents complained because they reduced the hours from 100 to 78, and they complained and they want them back to 100. I think now they have found a happy medium, but still it's something to consider if one wants to go to North America. So coming to my end, I think other thing one has to consider very carefully is also, you may want to go to a country where you have the amenities. You have, you may want to do several sports. You might suit, your cost of living, and you may have friends or family, support networks. These are all important things. And I'll just say one thing for us, who are supposedly the supervisors and the mentors. Actually, for us, is more important than you, equally important. I feel we benefit a lot from, it's a reverse mentorship. I think we benefit a lot from having fellows, because there is this interaction. I can tell you it's very rewarding. And of course, mentor comes from a Greek word, from Homer's Odyssey. I'll just say, finally, it's each individual's responsibility. Try to get the support you need wherever you go. If you have, even if you get a fellowship, don't expect everything to come on the plate. It's up to you to ask for it, and just be active. Join professional societies, as here, the ENS Young Neurosurgeon Society. Do your networking, and have a life outside work. And certainly, my life outside work, I do a lot of walking, gardening, baking, and dancing. So everybody, that's quite important, to keep a good work-life balance. And I would say good luck to whatever you decide, and you're very welcome to contact us in Manchester if anybody wants to have any fellowships. And I'll just stop here and I'll stop sharing, and thank you for listening.
Thank you very much. That was very, very informative and a great overview of what it means to pursue a fellowship training and why you should do it. And there is a question that you mostly answered during your talk about foreign trained neurosurgeons that want to pursue a fellowship in the UK, and what they should do, and if we know any specific places for functional neurosurgery in the UK that would be places that we would suggest.
I would suggest go to the Royal College website, because most of the functional fellowships are there. There are not that many, but if you go to the RCS website, they're there. It's advisable to have GMC registration and to have had your post-CCT exam you want to go and contact these people directly. But please go to the RCS website.
Perfect, thank you. There were a couple of other questions.
No, another the same. I think the same trainee is asking which fellowships have the highest chances of getting a job in the UK.
I think the ones that are more common, I would say, because obviously, if you go for something like functional, there will be less fellowships. I think there will be more, I guess, spinal and neuro-oncology, and less than you go to less skull-based, pituitary, pediatric, there will be less fellowships. So I think that, what are more common, I think it's spine, and also there are quite a lot of fellowships for spine which are combined with orthopedic. So you may get, like in our unit, we offer a fellowship where it's six months with orthopedic spine, where you get complex fixation, scoliosis, etc., and 6 months of neurosurgical training. So I think spinal fellowships are a bit more common, as most common neurosurgical pathologies, really.
Yeah.
Thank you.
Thank you. There were a couple of questions for this part of the discussion that had been sent beforehand from some of the network members. And actually, a couple of them are very interesting. One is, at what point does a fellowship make more sense? Should it be done right after the residency, or gain some surgical experience first and then pursue a fellowship training?
I think that's very individual question. I think you should have had some experience before getting to the fellowship, because otherwise you don't want to go there and struggle, because obviously you will be expected to do general oncology, etc. But I think it will be good to have had some significant experience before. But I would say probably straight after residence or 1 year after residence will be the ideal time. Because also then they become very competitive, and you may also change career path. I think my experience has been that if people go and do something else, it's actually quite difficult to come back and get into training. Your mindset is changing. So I would say the closer to the residency you do, the better. For example, if you feel your residency, like I did some of my training in UK and in Greece and came here, I did not feel that I would have been ready for a fellowship then. So obviously there are the opportunities to do kind of non-fellow, called clinical fellow jobs, but not subspecialty fellowships, where you can spend 1 year doing some general neurosurgery, get to know the system, and then do a fellowship. So that is also possible. And that actually I would say that's probably advisable, because that allows you to get to know the system, get the pressure out, get the stress out of the way. And then the second year you apply for a fellowship, knowing how the system works. You have a better chance of getting a good fellowship, having had UK experience.
And there are a couple of more general questions. One is, it's a combination of a previous question and a question that someone sent now. How should someone decide first of all, their research, and I will extend it to a subspecialization concentration of their training, and obviously that applies to the personal experiences. And the lifestyle someone wants to lead, but how soon should they focus their training on a very subspecialized or on a certain direction regarding their training? Should that be at the latest stage of the training?
Again, it's a personal thing. I think people know quite early on what they want to do. Usually people want to know early on whether, for example, they want to do cranial or spinal. Also, it is what opportunities you might get. Here, for example, in UK, they encourage people to have the research training, the research opportunities earlier. So by the time they become to the more senior years, they have already done the research, and then they can focus on the surgical competencies. It can work the other way around too, but I think it's easier to get your research earlier, and then you just focus getting more consolidating your surgical experience rather than the other way around. Because if you come out of clinical work for 1, 2, 3 years to do a PhD, it will be very difficult to go back and catch up. You kind of lose your skills a little bit. So I think I would probably favor an earlier research career and activity than later on.
Maybe Jose Luis can also give us
so
his opinion on that, because I think it's quite different between UK and
Exactly.
for example, countries like Spain.
Yeah, but I think I agree also, because I think the sooner you do after the residency, the better, because if not, your mind changes a little bit, and it could be hard to start all the time your training and your basic research. But I must say also that it depends also on your training, on your training side, and your if it's like strong enough, if your training has been strong enough, or you feel a little bit with weaknesses. If you feel very weak after your training, I will rather wait for 1 year or 2 years of young young attendee, and after that I will also start the fellowship or my focused research. But if you have done a very strong foundation, a very strong training, maybe just at the end of the residency, you can go for it and start your specialization. But I think most people feel it. If you are very weak and you're not sure about what you are doing, and you think that you need more skills, more surgical skills, more communicating skills, maybe you can wait for a year. It doesn't matter. Don't worry. Waiting for 1, 2, or even 3 years is not bad. But if you wait more, it could be harder to do a step back and start from the beginning all the way.
And a question for the whole panel, maybe Cesare could give his opinion on that. Does it make sense to do more than one subspecialties, fellowships in more than one subspecialty? Is that something that, for example, I would find it confusing if I did a skull base and a spinal fellowship. In my head, it would not work perfectly, but that applies only to me because that's how my head works. Is that something that, is it how I would really like to know other people's views on that, because
Yes, if I can say something on that, I think it depends, because there are some subspecialties that have a lot in common. For example, nowadays, in my opinion, skull base and vascular are becoming just one. But it's something that will be maybe in the next years. And yeah, of course, it takes more time to do 2 fellowships and different subspecialties, but sometimes could be helpful. But it depends on what are your opportunities and of work and of fellowship, of course. And I think that the most important thing is to be prepared to catch the opportunity that life gives to you and build your own network, as we have done and we are doing also with our young neurosurgeon network and the committee. The most important thing is to have a lot of relationship and a lot of friends also that could give you advice and could help you during your path to your right fellowship, or also for a second one.
Yes, exactly. It has to do with the opportunity. For example, Milan, you are now in Japan and doing different things. You have a focus. You are doing your vascular work there, but I imagine countries coming from Greece where we can't really work as a subspecialized surgeon like we do in the UK, for example. I don't know how applicable this can be in countries that work with an NHS system that is not.
I actually don't think it is applicable in all its glory, let's say, because in small countries like Serbia, like many small European countries, we must be general neurosurgeons. It's just not an option to subspecialize that much as we would like to. So I'm obliged to do, let's say, spine as well and vascular as well, and maybe I don't have to do skull base because there are not so many cases, and I think for our country it's less than 50 cases for PC angle tumors, and you cannot be subspecialist for PC angle if you are living in such a small country and your, let's say, patients are, even if all the patients come to you, it's still very, very small number, and completely opposite to that is here in Japan, where you have like first thing, they're only brain surgeons, they're not doing anything except brain surgery, and then they are so strictly subspecialized to cerebrovascular, to skull base, to neuro-oncology. I don't have an impression that they have any knowledge apart from that, what is done in their departments. Of course, that is some completely different level when compared to my initial experience, but that is something that is country specific, and I hope I will be able to accommodate it to some extent, but I don't think I could be more than general neurosurgeon in Serbia.
Yeah, exactly.
There is always a lot of controversy about that, because on the one hand, you obviously now every discipline is so advanced that you need a lot of time only to learn one discipline, only a spine or only vascular or only, and then you cannot take care of everything because otherwise you don't know anything about anything. You know only a little of every discipline. But on the other side, Milan is right. The problem is once you are well trained in one discipline or two disciplines, then in European countries, and I agree with you, it's the same in Spain, you don't have enough cases to get a big experience on this sub-discipline. Maybe spine and neuro-oncology, which have obviously more patients, but skull base, for example, is one of the subspecialties that in Spain you struggle really to have, and also vascular with the endovascular therapy now, you struggle to have enough cases. So you can be vascular surgeon here, and you can develop your skills maybe in the lab and also in a fellowship, but thereafter when you are here, the reality that you cannot get this number of patients anymore. But at the same time, it's very difficult to develop different subspecialties because every subspecialty is very, very, very advanced, and you need a lot of time to properly know everything happening there, and it's very controversial.
Yeah, if I can share my experience also, Evan. I mean, I did 2 fellowships. I did oncology and pituitary, and as you know, up to last year, I was struggling to try to juggle both. But in a big unit, I was feeling that I won't be good at both because it's very difficult to keep up with your CPD. It's very difficult to keep up with a high volume unit. But so I had to drop one, and that dropped the pituitary. But I guess if I was working in a smaller unit where the workload is not so much, I would have been able to keep up both skills. So I guess it varies, as you say. But it's becoming more and more subspecialized, I must say. But again, you have to adjust to the country you work. But I would say whatever skills you get are transferable skills, you know. So they're not going to go wasted. Whatever you learn, they're not going to go wasted. You know, like even whatever I got from pituitary, a bit of endoscopic skills, I can now apply to oncology. So there are transferable skills. So nothing is wasted at the end of the day.
Yes. Thank you. There are a couple of questions from the audience as well. One is for probably Christina and Jose Luis. For applying for residency in Europe, the first question is, should they definitely apply for internships? Does this actually enhance the chances? And the second, which was more or less answered during the talk, and the second is, should the students do a research year before applying? For example, like it happens in most cases in North American countries, where they do some 1 to 2 years of research first as research placements, and then they apply for training. Is that something that makes sense to do it in Europe as well?
Yeah, I totally recommend to do international internships, at least inside Europe. We have had last year one intern from Italy, another from Poland, and it's an amazing opportunity for them, and it's also a good opportunity for us because we learn a lot of things with them. They have time, they have enthusiasm, they like what you are doing, and they love what you teach them. So they did the research while they were with us. They didn't do any previous research, but they did it with us, and they love it. It's a beautiful opportunity for them. It's a beautiful opportunity for us. So I'm sure that these two med students will be neurosurgeons and will be successful neurosurgeons because they are passionate about what they are doing. So I highly recommend, if you have the opportunity, do it for several months, for several weeks, the time you have. It's valuable, but it's a nice, amazing opportunity. Yeah?
Christina?
Yeah, I totally agree with Jose Luis. I have nothing to add.
Yeah. All right. And there is one last question I think that applies to the whole panel. And it's kind of my fault because I mentioned before about people that might, during their training, they might not be very happy with the unit they're training in and might want a change of scenery or pursue a unit that offers more opportunities. And the question is, do any of the panelists have experience with either personal or with trainees, having met trainees that at some point during their training pursue a change, and is there a process that someone could recommend for achieving that in a relatively successful way? Cesare, you've
Yes, I can speak about Italy. It's possible to change unit, and you have to ask to your university and to university where you want to go, and both they have to say okay, but it's not so uncommon. It could happen, and it's normal-wise, it's easy to do it. But I think that if you change for something that it isn't so good in your training, from the perspective that you do not do a lot of stuff, or you are not happy with your boss, it's something that it comes harder because you have to gain the okay from both universities. So it depends, but if there are changes that are made just for other reason, it's straightforward.
Ms. Karabatsu, having met quite a few trainees so far, do you have any experience or any advice on the subject?
In UK it's extremely difficult because the training places are so few that the only way to get, I know in so many years I've been around, the only couple of people manage to transfer, and that was you have to have a very serious reason, like a spouse in another city who has some health issue or something really, really personal which is serious, and that unit has to, or you can find somebody to exchange. So like somebody wants to go from London to Liverpool and vice versa. Otherwise, the only other thing you can do an out of program. For example, if you want to do an academic, for example, if you want to do a PhD, we have even a trainee from our unit who is now in Cambridge doing a PhD for 3 years, that you can do, but it's extremely difficult to move from unit to unit because it's very competitive and people get their preferences when they apply for the training post. And according to the score you get in the national interviews, you are allocated a place. If you're lucky and you score very high, you get your preferred, otherwise you don't. But what you can do is obviously after your training, you can go and do your fellowship. The other thing I would say also in UK, sometimes you rotate between units. So for example, in Manchester, you rotate between Manchester and Preston. So you have the opportunity in most places to rotate. In Birmingham, you rotate between Birmingham and Stoke-on-Trent to actually have exposure to other units, which is not bad, but to change training rotation is extremely difficult.
And thank you very much. And Jose Luis, if you had someone coming to you as the training director in your unit, telling you that, you know what, I'm not happy where I am, I want to come to your unit, what advice would you give them?
Yeah, first that in Spain, also as in UK, is very difficult. That's like a political issue. It's very difficult to change the unit. It's true that is easy to organize a kind of rotation or clinical visiting, I don't know, rotation to another unit, but it's also but a small period of time. You cannot change your place of training easily. Okay, so what advice could I give him? So I can offer him to a visiting rotation here for a while, but in Spain, this is a very tough problem. Yeah.
Thank you.
In Spain, for example, it's completely different than Switzerland or Germany, right?
Yeah.
Where they start in one place, they in the intermediate range of the career, they are here and there, and they finish in another place. And at the end of the training or the residency, they have been in 4 departments or 5 departments, very equally. In Spain, you have your base, your headquarters, and thereafter you can visit another one, even for 6 months or 3 months. But your department is always your department. And I think it's the same in Italy, for example.
Yes, it's the same, and the residents can rotate for 18 months abroad or extra the school, the university. But it is possible also to organize some rotation. And nowadays, all the schools have more than one hospital and more than one place where it's possible to go. So during the residence, the rotation are a lot.
I cannot see any other questions in the box, and I think we have passed a little bit our time. So thank you all very much for this very interesting discussion. I hope it was for the attendees what they were looking for, and the information they got from it will help them while they're planning their training. And of course, I need to remind everyone that we are waiting for all of you in Madrid in June, 8 and 10, for our annual meeting. We have organized a lot of parallel activities with hands-on courses and research courses, and it's going to be a full 3 days of training and education and mentorship. So if you have the opportunity and if you have the time, please join us. It will be, I think it's going to be the most busy and full of activities meeting that we've ever done as a Young Neurosurgeons committee so far.
Yeah, I wanted to say I'm proud and I'm happy that with all of these participants, I think the network has had a good welcome. And thank you to Evangelos, especially Evangelos, but also Cesare, Christina, and Milan for working on that hard for them, I have to say. And of course, to Jose Luis and to Constantina, because they are giving freely, they're not paid. They are here for free, just to help us and to collaborate with the network and with the EANS Young Neurosurgeons Committee. And same than Evangelos. This year, the meeting is in Madrid, is 8-10 of June. And I think it's the first year we had enough time and enough resources to prepare everything as we wanted from the beginning. And we have research course for the youngest ones, for the students, research course for the older ones, We have skills courses for the youngest, craniotomy, sutures, and advanced courses for the older ones, for the older, always young, but older, up to 10 years after board certified. And it's not only that, the program I think is amazing. It has been done with all our heart. And also it's very important that you will have the opportunity to networking and to meet people from all Europe, and not only Europe, because it's also Asia, Africa, and South America this year. So people who join will have, as Constantina mentioned, online is very good, but face-to-face is much better. And I think in Madrid, everyone will have the opportunity to meet people from everywhere, young neurosurgeons from every country in the world, because it's almost global this year. So you are welcome to join. It will be happy for us to host you here.
Perfect.
That's all. Thank you everyone for joining.
Thank you all very
Thank you,
much.
Marisa.
Thank you.
Bye-bye.
Bye.